Hello everyone, in this video we are going to discuss about the science of cakes, the fetal cakes or baby cakes. This video I particularly have made for the mothers, the general public, but the students can also get some kind of insight from the science. So during pregnancy, it's a very common and pleasurable experience to feel the kick of the baby. It's an immense feeling for the mothers. Now let's discuss this thing from a gynecologist point of view and have some important info about this. First thing you should know that once the baby is inside the womb reaches up to 28 weeks or 7 months, baby just becomes like an independent person. Even inside, baby behaves just as similar as it is outside once the baby is born. So there is literally very less difference in the behavior of the baby whether it is inside of the uterus or it is born. Baby inside the womb can listen to the voices, it can open the eyes, it can swallow, it can urinate, it can defecate, and also it can move its tiny limbs, little tiny limbs, just like we see a baby when it is born. It can do even inside the uterus. And a very important thing, it just sleeps like outside, it just awakes like outside. If it is sleeping and there is a voice or there is a sudden movement, it can awake. All the things I'm trying to tell you is that the baby remains same whether it is outside or inside the womb. It can also frightens just like outside. So it's very important to baby to do all the activity to stay healthy till delivers. Okay. Now all these activity are normal, and for a healthy baby it's important that the baby should do all these particular activities inside the uterus. Now, with the use of sonography or ultrasonography, as you say, you actually can see the baby moving, trying to breathe, and all. The movements of the baby, the tone of the baby, the respiratory movements of the baby, all can be seen via ultrasound or sonography or 4D sonography, kind of that. But when ultrasonography is not there, or uh, for general people or persons, when the baby moves one of its limbs and it smashes against the uterine wall, the mother feels it's as a kick. So a mother by herself can have a record of movements of the baby. We can't see all the things the baby do in the uterus, but what you can do, you can sometimes feel the movement of the baby, or a flickering, or sometimes kick. Flickering are the smaller movements and kick is a larger movement of the baby, just like here. Now the movements of this baby tells about the health, or in our medical language, fetal well-being of the baby. There is a certain number, as we have defined in medical profession. What we consider, we have a certain number, and that number is more than 10, more than or equal to 10 kicks per 12 hours is considered as a sign of healthy baby. So again, I'm not telling this is absolute numbers, but this is just a parameter that how we assess the fetal well-being, or how we doctors assess the baby is healthy or not. That is 10 kicks per 12 hours, at least 10 kicks per 12 hours. Okay. Now how to easily monitor the number of kicks or count of the kicks? Now it's impossible for a mother to concentrate just 12 hours and continue to notice or note down the kicks. It's not possible. What the mother can do, it's a very simpler method, and very simple method every mother should every mother, every pregnant lady should focus or should go for this kind of exercise. In that is, they should fix 3 particular hours: 1 hour in the morning, 1 hour in the noon, and 1 hour in the evening. And every time they are focusing like 1 hour, they should note down the total count of kicks, and they should sum up the total 3 hours counts, uh, and multiply it by 4. That will give number of kicks per 12 hours. So this is how you can do it. If it is more than 10, then it's considered as a normal and your baby is most probably healthy. Just like outside, babies can sleep and awake into the uterus. So when the baby sleeps, they don't move most of the time. And so there are no kicks. So most of the time, the mothers or the pregnant ladies comes to the doctor or us with this complaint that baby hasn't moved since 5 hours, like that. But most of the time, it's because of the baby is sleeping. Just remember that baby sleeps just 16 to 17 hours per day inside the uterus. So most of the time baby is sleeping inside the uterus. So in this time you might feel there are less kicks, so don't worry. Do the baby respond with the voice or sound inside the uterus? Yes, they do respond with the sound and voice. Just clap near the uterus and you might get a kick. One thing is very important also, that there is no fixed time limit or there is no fixed gestational age when a mother should start expecting the baby kicks. Most of the time the patients or the mothers comes to us and they say that it is just 5 months and I am still not feeling a kicks. So the feeling of kick or uh, the perception of the kicks is varies from person to person. So all the mothers will not start perceiving that thing at the same time. So there is no time when you can start feeling the kicks, but yes, there is a time limit. There is time limit of 28 weeks. By 28 weeks or 7 months you should actually start getting the kicks. So this was all about the baby kicks. Thank you, friends.